Hi everyone, and good afternoon here on the Friday afternoon in Sydney, where Suzie and I are. Just wanted to give a big shout out to all the workers there around the world. Today's the 1st of May and many other countries celebrate this as May Day. We don't, but just want to flag that for this afternoon. I'm Nadine Ezard. I'm the Clinical Director of the Alkaline Drugs Service at St Vincent's Hospital in Sydney. I'm also the Director of the new National Centre for Clinical Research in Emerging Drugs. And this is our second webinar in the series that we've launched during this time of the COVID-19 response to look at some of the issues that are facing our sector in delivering services to people during this time of COVID, with very rapid changes in the way that we're delivering services. I want to give a thanks to St Vincent's and to the National Drug and Alcohol Research Centre, which are two of the consortium members of the National Centre for Clinical Research in Emerging Drugs, for hosting and supporting this webinar series. And I also want to acknowledge the traditional owners of the land on which I'm seated at the moment and pay my respects to elders past, present and emerging. During this series, we're going to have in-depth discussions with a range of people, clinicians, consumers, family members, to look at some of the immediate problems, some of the research endeavours and new clinical practices and opportunities, as well as barriers that are emerging as part of our COVID-19 response and as it progresses and evolves over the next few months. Last week, we spoke with Dr. Liz Nock, a clinical psychologist, and this week I'm fortunate to be speaking with Dr. Suzie Hudson, who's a mental health social worker with over 20 years experience in clinical practice and is currently the clinical director of the New South Wales umbrella group for NGOs called NADA, the New South Wales Alcohol and Drug Agencies. So is that right, Suzie? I'm going to hand over to you to introduce yourself because I'm making a complete mess of it.
It's absolutely fine, Nadine. We do indeed represent NGOs across New South Wales, and NADA is the network of alcohol and other drugs agencies. And our job really is to support workers, looking at their practice, supporting them in terms of their wellbeing, and to provide advocacy for the NGO sector here in New South Wales.
Right. Thank you, Suzie, and thanks so much for agreeing to do this today. Before we get going, I just wanted to say to anybody out there, if you do have some questions, please use the Q&A button at the bottom of the screen, and we'll get to your questions probably at the end, where we'll have some time to discuss them. But please do send in those questions. We really do want to have this as more of a discussion. More of a relaxed kind of informal session. We're only got 20 minutes or so of the discussion between Suzie and I, and then 10 minutes at the end for questions. So please do send in your questions. So before we get going, Suzie, we have had this rapid shift where many of us have had to suddenly deliver much of what we do online or through the telephone or through the internet. And I just wondered if you could talk a little bit about what other ways that we can prepare our workplace for some of the privacy and confidentiality issues that go along with that. We're used to working in a closed environment where people perhaps sign release of information or sign confidentiality agreements. We explain clearly the limits to confidentiality, but then suddenly with this unprepared shift to online service delivery, that does actually bring some of those privacy and confidentiality issues into foreground. I wondered if you can explain from your experience what are some of the things that we can actually be doing to respond to those or anticipate some of the concern.
Yeah, look, Nadine, I think it's our workforce have really responded incredibly, because you're exactly right. There hasn't been a lot of time to really consider what some of the issues might be, and it is true that for some of us it's been a bit of a learning on the run experience. So I think really clearly what we need to come back to is some of the things we already have in place. So our privacy legislation still applies. In terms of privacy, we're really thinking about the conversations we have, the documentation we make, who is able to access that information. And then when we're talking about confidentiality, of course, we're talking about, I suppose, helping people to appreciate what might the differences be from moving from a static place, so that is a particular clinic or office area, perhaps into our own homes, and what we need to do to really prepare for those. So the first thing is really to look back at what privacy and confidentiality policy documentation our organisations already have. They will give us some hints about the things that we need to take into account. So we need to prepare our workforce. Partly that would be about ensuring that they have identified a space or place in their home, perhaps, or in a location where they're not going to be overheard by anybody, that they are using and have access to the equipment that's going to ensure secure platforms are being used. This has been quite a debate, actually, Nadine. It's been raging, is really what are the safe platforms to be using, and that really comes down to the organisation. So it is true that clinicians, wherever they are located or associated, they really need to look into the background into some of the platforms and work out whether they are indeed secure, that they do comply with the privacy legislation. We also need to be thinking about how
notes. Up there, Suzie. So, do you give your members guidance? I know for us at New South Wales Health, there are 2 platforms we've been informed we can use, PEXIP and Skype for Business, which aren't always particularly friendly from the user end. So the consumer, if they're at home and they don't have a lot of data or they don't have good equipment, they probably can't access those things. They're better from other clinics. For your members, for NADA members, for NGOs, are you giving guidance, or is it up to each member what they're using? I know some private practitioners are using Zoom, and we're fairly convinced Zoom isn't that secure.
Yes, look, I think, Nadine, we as a peak have stepped back from actually advising, because what we do know is that, in any particular situation, I think we need to be prepared to be very honest with our client group and saying that there's possibility for breaches to occur, but that they are looking at each platform on its own merits and providing that information to clients as well. But actually, more than that, it's about giving people choice, Nadine. I think this is where we sometimes get caught up a little bit, is it's about providing as much information to the client as we can, and we provide them with the choice. So, for example, if they don't feel comfortable, and some people just don't, with a video platform, then actually using the telephone can be a lot more secure and private. Particularly if we are in a situation where we can provide a phone number to them that's a work phone number, or that we can be clear that we're actually talking to them. I mean, that also starts to talk to other issues around privacy and confidentiality, about who has access to the devices that we're using, both from the clinician point of view or the worker, as well as the client. So in terms of what we're doing as a peak, we're being very clear that organisations need to be exploring all of these things, understanding what things like encryption actually means in terms of the flow of information, being clear about whether things are videotaped or not, and I suppose too, really offering clients, particularly in the case of COVID-19 situation, options, because we do know, as you've described, not all clients have consistent access to the amount of data they may need, or the devices that they may need that would support this type of counselling or information providing. In terms of some of those other safety issues, I do think one of the clear things that's come up a lot for people, particularly for those who are not specialists in relation to domestic and family violence, is not really, or needing to be really clear about how appropriate telephone or video counselling can be for people that are not necessarily as safe as we hope they might be in their own homes. So what we know is that, devices, if left around the house, or if you have multiple devices like an iPad, for example, as well as a phone, that messages may pop up on those devices, or there may be ways in which people are not necessarily as safe and secure as we can be clear about when they come to when they're with us in our counselling space. So The good news is though, there's lots of good resources, and what I can do is I'll provide links to those resources at the conclusion of this webinar, and we can actually make those available. But certainly the specialists in domestic and family violence have done some really great work about things that clinicians in the drug and alcohol sector can apply around safety, preparing the client for what this experience might be like. For example, if, you know, that they, just like the worker, have to identify a safe space for them in their home. And whether is that possible? And so really exploring those sorts of things. Also thinking about a lot of those other issues that might pop up around if, for example, you're concerned during the course of the counselling or the support about someone's mental health or their safety in terms of suicide risk, in terms of their physical safety. What are some of the things that you need to be doing to prepare that client before actually engaging in the therapy or in the counselling that might be going on? So it may be that you're having to sort of speak to them about, you know, identifying a safe space, a space that perhaps doesn't have other significance. For some people, for example, being in your bedroom and talking about very personal things such as sexual abuse or trauma related to childhood can be very triggering. So helping people orient is really important. And I think that's maybe one of the things that we perhaps have been caught out a little bit in this very swift transition, is we haven't had the time to really prepare our clients for what this experience might be like. So the ways around that. Yeah.
Can you help me with that? Because I know in my own experience, when I've even if it's a client I know, and then we're talking on the phone, and I start the conversation by saying, are you somewhere where you can speak? Do you feel comfortable talking? And often I go, yeah, it's fine, all good. And I don't get a sense that people are really present on that conversation with me. So how can I help people to orient? Have you got some tricks for me?
Yeah, that's a very good question. Yes, I do. I think one of the first things can be to, I suppose, start to reorient the way in which we usually might talk to somebody. So when we're face to face, a lot of those cues are already ticked off. We don't even need to check in. And the tricky part is when we transition to this more remote way of working, we're still applying the same approach that we would elsewhere, but just with questioning. So, for example, just sort of saying, how are you feeling, these sorts of things. And actually we need to totally turn that head. So if, for example, I'm starting the conversation with someone, I might preface it by sort of starting to alert them to the fact that this is going to feel a little bit weird. This might be feeling a little bit different for you. It certainly does feel a bit odd for me, because it's what I really enjoy about obviously supporting you is being able to see you. I get a sense of how you are. So I'm hoping that you might be able to help me out a little bit with some of those things that I can't see. So I'm wondering, can you're telling me that you're in a safe place. Can you tell me a bit about what you can see? What is it that's around you at the moment? And although that might feel really a bit clunky and a bit odd, you're actually trying to help that person, as well as yourself, reorient to this different space and this different place. Because frequently the questions we may ask, particularly around how people are, so how are you today? When we ask that when people are face to face with us, we're getting all this other messaging going on that helps us ask further questions if we're not really sure, or we need to clarify whether that is actually how someone feels. So in the case of, say, a telephone call, it might be to really ask them more open or descriptive type questions about how they are, rather than just those more perfunctory, how are you going today? So an example might be, you might say to someone, in the last hour or so, in knowing that we were going to have a bit of a chat today, what were you thinking about? what was going on for you in your mind? And they may give you closed answers to that. Oh, nothing, you know, I'm fine, it's all good. And what I would be saying, perhaps in response to that, is, can you just tell me a little bit about what that means to you? Because I'm genuinely interested in understanding, what does that mean for you? Is it different from when we caught up that time face to face 2 weeks ago? When we were together then, you were telling me a bit about something. Is there anything different that's happening for you at the moment that might be helpful to talk about? Or is there something that you can describe or tell me about that can help me understand where you are at today? Does that make sense? It's sort of...
Yeah, and do we need to be also changing our objectives and aims as well? I know that some clients have mentioned they find the kind of more cognitive work is a bit harder to do on the phone.
Totally.
And it's more kind of goal directed and practical, and
Yes.
the conversations tend to be shorter.
Yes. I think that's absolutely sound. I think particularly for people for whom this is not, you know, remote contact is not as comfortable, I think it is absolutely sound to reorient the way in which we provide that support, and asking them, providing them with choices and options, and asking them which they like better. So, you know, you might try some of these things out and ask them, did you prefer it when we spoke a little bit more about some practical things? Was that more helpful to you? I think it's that feedback that's really much more present. It's important in a therapeutic situation ordinarily, but it's even more important in this setting where you're checking in with people about, you know, would it be helpful for you today? You know, I feel like perhaps there's a few things going on for you today that may be either on your mind or in the room. What would be helpful to you? And this, you know, this is the beginning of the conversation, to talk for a shorter time more frequently, or would it be useful to speak for our usual amount of time? So exploring some of those options is useful. It might also be that you pose a question or an activity and you invite them to do that or to engage with that, and that when you catch up with them next, that maybe you can talk a bit about that. And even if they don't do it, it doesn't really matter. You can talk about, what was it like for me to ask you to do that? What were the things that got in the way? You know, what's difficult right now? Or, well, I feel like I'm juggling all these other things and the needs of my family because they're right here with me. And then you can start to really tap into, you know, all the strengths, the things that they're actually coping enormously, you know, with enormously difficult times, and sort of focus things on the things that are really working well. So you can utilize and shake up the ordinary or the usual way that you would practice. And that's where I think actually, although very distressing for a lot of people, this has provided new opportunities for thinking about.
So I like the way you're actually talking about how we can change our practice in potentially beneficial ways. So the more frequent, shorter check-in, because you're not demanding travel time of people, can be advantageous for some people, and we wouldn't.
Absolutely.
I wouldn't feel so comfortable demanding that of someone if they have to travel an hour and a half each way. But if we can actually touch base more frequently, I know with some of my clients we're doing that. I'm certainly getting more frequent contact than I would have had otherwise. So there are some opportunities.
That's right.
Are there some other opportunities that you think that we're exploiting in this situation?
I think so, Nadine. I think one of the key things is around reorienting what we're doing in this interaction. So that is to say, we perhaps are ensuring we get some of the key information. Of course, we need to do risk assessments and safety checks, and we have to find out how people are going and all of those things. But it's also maybe reorienting, actually sitting here and going through a battery of questions and flogging that right now might not be the most helpful thing right now. And so perhaps that gives us some signals about the way in which we do that first engagement with clients, that we actually centre it more on what is it the client needs right here and now in this moment. That we are tuning in very specifically to not just what they're telling us, but all these other things. That we're using the opportunity to really get that feedback about, you know, what is it like for me to ask this of you, for you to, you know, to have this come into your house and or your place of residence, you know, where you stay, you know, what other things might come up as a result of you not being able to get out of your space to come and see me and to talk about some of these difficult things. What, you know, all those things I think are opportunities, and also tells us that going forward, should things, you know, return to face-to-face, and I'm sure they will, is there something that we can be doing that might fit for that person better? You know, maybe they do get they find it a lot more engaging, actually, to not have to look at you, to be on the phone. I mean, it sounds weird, but I mean, it's very unnatural for some people to sit face-to-face in constructs that are very Western model, often quite medical. And I'm thinking about, you know, what DAMEC workers have spoken to me about just recently.
That's the Drug and Alcohol Education Centre, yeah, in Sydney.
Oh yes, thank you. Yeah, so talking with their culturally and linguistically diverse clients,
yeah,
for some it's just not useful at all, but for others, actually, it's quite unnatural to come into this clinic. Obviously, there's lots of shame associated with some of that experience. Then it's a very authoritarian arrangement. And so talking freely about your feelings that are not going well or can be a bit unsettling. So actually being over the phone and not having to sit across from someone can actually, for some people, be quite freeing.
Mm-hmm. And does it allow it to be more anonymous? Or?
Can do, absolutely. I mean, it's difficult, obviously, if it's a previous client who you're now seeing. But in my private practice, I'm speaking to clients that I haven't actually met yet.
Yeah.
Face to face.
So it's sort of a decreased threshold of entry to treatment potentially as well with some of this online or remote work.
I think so, and I'm sure some of your ADIS clinicians have really can speak to that there is this real sense of, I'm dipping my toe in, I'm seeing where it goes. Actually, this is quite safe. I can talk about these things. You know, maybe I want to take that further, or maybe I want to just keep it where it is now.
ADIS, just for people who maybe aren't from New South Wales, is the Alcohol and Drug Information Service, and that's a telephone service in most states and territories around the country, and we will be having one of these conversations next week with one of the counsellors that does work only on the telephone, and she'll be talking us through some of those micro skills that as she calls them, for how we use our voice when we only have our voice to communicate with. So that'll be next
Fantastic
week. So yeah, just going back. So just going back though to some of the safety issues, Suzie. Anecdotal, getting a little bit more experience in calling ambulances for people when we're concerned. So if we had a face-to-face session and someone was in either physical or mental crisis, then we could respond more confidently, more readily. But on the phone, we have anecdotal hearing of some practitioners that are concerned enough to call ambulances. I just wondered if you had any kind of experience about how to make that decision, how to negotiate that with the person that you're on the phone with, and what are some of the difficulties with that and how to manage that?
It is very difficult. I mean, I think the main thing is that you're broaching those subjects before they have the potential to occur. So for example, you are really just exploring with them in that sort of setting up period, that first contact, that what the differences are now that we're in this space, particularly with someone you've had contact with before, that you hark back to those conversations about confidentiality, that if you were concerned that they were going to harm themselves or somebody else, that they would look to be reaching out for involving other people, other supports. And so what you would hope is that whether it's a brand new client or someone you've had previously, there has been some discussion about the need to take action if the person working alongside them is concerned for their welfare. And so in that way, you've already signalled quite early on, and you should be really revisiting that in each introductory discussion, that, you know, about their safety. How, you know, are they feeling safe today? That there is that, who is it that we can ensure we can contact if we can't get in contact with you? And if you do have significant concerns about a client, it's well worth actually being clear about asking them where they are, if they're happy to share with you where they are when you're talking to them, and explain why. I think that people, particularly workers, their hesitation around these issues can be their concern that somehow it will impact the rapport you've built or people's sense of safety or security with you. And I actually think that the reverse is true. The consistency, the honesty, the transparency in providing information means that when those situations occur, there's actually no surprise that you took the action that you did. For example, you might be saying, look, this is all a bit of a shift for us. It's going to be helpful for me to know where you are so I know that you're safe. And if I was concerned about your mental health or that you're going to harm yourself or somebody else, there is the potential that I would seek to get help to you. And so I do think that it's through that transparency and being really open and honest about that you are adhering to your duty of care. And I suppose too, I haven't actually had the situation in which a client has been surprised that I would want to ensure that they're safe and well.
But so would that also hold for a client that missed several telephone appointments that you had with them? Would you then do a welfare check that they were not aware of, or would that be something that you had already addressed with them, or how do you manage the missed appointments then?
Yeah, so missed appointments are, I think, are slightly different. I think what you would be trying to do is ensure that you had different ways of connecting with them. So, for example, and really putting it to them. So you're coming to say you've had a session with someone, you're coming to the end of that session, you're perhaps arranging a further contact. I'll be raising the question. Now, if I'm unable to get in contact with you or you don't contact me, what should we be doing about that? Because I think, you know, I think just being really honest about what the potential situations that can occur if no contact is created helps mitigate that sort of thing escalating.
Yeah. So
does that make sense?
Yes. Yeah. So it's about just tying back to where you started, which was setting the groundwork with that kind of, not a contract, but the kind of therapeutic agreement that you have from the outset, how to manage missed appointments, how to manage acute problems, how we both are hoping to be able to work in a way that we can connect remotely with a private space and enough bandwidth and enough data to not get cut off.
Exactly.
Battery, I mean, I've had it all so far, battery running out, people listening in, all those kind of things that are kind of rookie, I guess, things that happen to us when we're not experienced with it, and how to prevent them happening in the future is what I'm trying to learn, I guess. So stepping out some of that is really useful. And I think you're going to share with us some materials that Turning Point has released about some of those mistakes that we all make if we don't think about it in advance.
Yeah, that's a really good resource. And in fact, I just did Insight in Queensland. I've done a webinar, an e-learning that's all about this exact topic. And I think that's another really good one, because I just, you know, they're quite easy to do. And I think it just tells us a lot about the preparation, but it's also, you know, we're all learning. So just be as honest as you can with your clients. They get it. You know, we're all just doing the best that we can. It's about no surprises as best you can.
Okay, great. All right. So just so some of those materials will be shared with the link to this webinar. This webinar is being recorded if anyone wants to recommend it to anyone else to follow up. And I just want to thank you, Suzie, for being part of this.
You're very welcome.
It's been really great.
Thanks.
Bye.
See ya.
And bye to everyone out there. Thank you.